Doctor, we have 1 more minute and then we will start.
Okay, sure.
Namaste and a very warm welcome to everybody present here. I think we will wait for 2 more minutes. People are just joining. We will wait for 2 more minutes and then we will officially start. In the meantime, if anybody would like to please open up your videos, please keep ready, your videos on, especially women. Let us not be shy. It's our day today. So let us all, yes, be there. Open our videos. Thank you. I think we have 15, 16 people joined us now. There are many people more joining us. Thank you. Thank you, everybody, for opening your videos. I think we will start. Namaste once again to everybody who have joined us today. It's a wonderful day. We are joined here as Sri Shakti today. And this is our first program of Amma Kuwait for this year. And before we start, may I please welcome Srila Ravi Prasadji to invoke Amma's blessings before we start the program. Thank you, Srilaji. Srilaji, please.
ॐ वक्रतुण्डमहाकाय सूर्यकोटिसमप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा ॐ नमो भगवते महासुदर्शनाय वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वभयविनाशाय सर्वरोगनिवारणाय त्रिलोकपतये त्रिलोकनाथाय श्रीमहाविष्णुस्वरूप श्रीधन्वन्तरी स्वरूप श्री 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 औषधचक्र नारायणाय Namaha.
Thank you, Srilaji, for invoking Dhanvantari today. And I hope with this seminar, all of our problems, all of our health issues gets addressed and people find answers to their solutions, to their problems. We have a wonderful speaker here, Dr. Sarita. Dr. Sarita has many, many years of experience, more than 25 years of experience. Dr. Sarita, I had to introduce you to all our people who have joined. They don't know much about you, so we would like to give a very short introduction about you. So Dr. Sarita has an MBBS MD gynecology, and she also has an MRCOG from the Royal College of Obstetrics and Gynecology from UK. Her area of expertise is, you name it, when it comes to women's health, you name it. Be it menstrual issues, be it contraception, be it ovarian health, be it conceiving problems, be it fetal development, postpartum, uterus issues, urinary incontinence, you name it. And Dr. Sarita is an expert in all of this. So without much ado, I would kindly welcome Dr. Sarita ji to please enlighten us with all the issues that women face.
Namaste.
Welcome.
Thank you for such a good introduction.
You named all the things what I am supposed to talk on. Thank you so much.
Sure.
Yeah, so we are thinking about problems of females actually. So let us start from neonates. Soon after birth, what happens when the baby is inside that uterus? It is under the influence of so many hormones, very high hormones. So many of the time we see parents getting panicked, seeing a little bit of blood coming out from the vagina of the female neonate. This causes really very frightening situation. So this is I'm just telling to start with, means we are starting from the neonate and we'll be progressing as per the age. So this is just because of the sudden withdrawal of the hormones when the baby comes out. When the baby is separated from the placenta, the baby has its own milieu. Then the hormonal effects will wane off slowly. So that causes a little bit of bleeding because those changes, the hormonal changes happen within the uterus. Inside the baby's uterus is getting withdrawn. So it presents as a bleeding, little bit of bleeding. It subsides by itself, nothing to worry about it. And sometimes we see fetal ovarian cysts also just because of these hormonal effects. And so when we see an ovarian cyst while doing a scan of the baby, when the baby is in utero, many of the time we don't have to worry about it. It is going to go once the baby is away from the placenta, separated from the placenta and the maternal hormonal milieu. This is first thing I wanted to say. And as neonates, actually, we don't see much problems. And sometimes we see with synecdoche, it is called synecdoche because as a neonate, the baby is not having much of estrogen once the maternal estrogen is withdrawn. So there is a condition called synecdoche, means this is the additional labia minora of the baby getting adherent to each other, so that we may not be able to see the vaginal opening. This is a situation seen very rarely, but this also causes parents to be frightened seeing this. So they come, and this also, it is hormone dependent condition. We treat with a little bit of very low concentration estrogen locally. And sometimes it needs a pediatric surgeon involvement also. This is second problem. Then as a baby grows, female children are more prone to get urinary tract infections. That is because of the proximity of the genital tract to the anal tract. So we have to teach them to properly use water while safe, not to contaminate that area, because the urethra is also very near, and vagina, then the anus. So washing technique, you have to teach the children, the female children, more consciously. The water should not contaminate the front area. This is something which is going to protect them for life. Then urinary tract infection, then comes the puberty. Puberty means it's lots of problems. Many of the problems are just because of the emotional problems. And that is okay. See, it can be dealt with proper counseling and being with the children. Parents should be with them, spending enough time with them, explaining things. And when the child starts getting periods, when we call it menarche. Puberty means it has 3-4 divisions, means 3-4 steps. See, first is the adrenarche, means the child will start getting pubic hair and axillary hair. Then will be the breast development. Then will be the menarche. Menarche means the proper onset of menstruation. The first 2 years of first 2 years from the starting of the menstrual cycle, it will be irregular, and most probably it is not ovulatory cycle. So ovulation will not be happening. So it may not be means very regular. It may not be regular, and the bleeding may be more or less. Both can happen. See, one of the causes when the bleeding is more is anemia itself. Because anemia causes more bleeding to occur. So this is once the child is having more bleeding, something you have to think of is the child may be anemic also. So she needs medical attention. We have to give her healthy food, taking care of the iron intake. This is what they should do then. And irregular cycles in the early years of menarche. It can also be because of the onset of polycystic ovary. By the time age 8 or 9, there may be, if the child is having a tendency for polycystic ovary itself, and the polycystic ovary hormonal changes can start delaying the onset of period also. That so when the child is not getting period even by 13 years, definitely they should get medical attention. We should see why she is not getting. And many of the time the onset of menstruation in the child is almost the same as the mother when at the age of, at what age the mother achieved menarche. And then comes the dysmenorrhea. Dysmenorrhea means painful menstruation. Painful menstruation is usually an indication of an ovulatory cycle. So initial cycles will not be painful for the child. So when the ovulation, when there is an axis, hypophysio-pituitary ovarian axis. That axis, when it matures, the child starts getting proper regular periods. Then the cycles become ovulatory. So till then, irregular cycles, painless cycles usually the children get after menarche. Once they start getting regular ovulatory cycles, it becomes painful. This is usually what we see. And the pain usually is single day pains. On the day when they start menstruation, they will have pain, and it goes off once the bleeding sets properly. This is called primary dysmenorrhea. Nothing is to be done, just reassurance and pain relief. You can give them mefenamic acid or paracetamol. That is enough. If it is if the pain starts before 2 or 3 days before the expected period, and it lasts 2-3 days after the proper bleeding, then we have to consider an ultrasound scan to see why. This is called a second congestive dysmenorrhea. Congestive dysmenorrhea means there is some problem which is causing pain, and maybe the bleeding is more also. That I think this is the problems of puberty. Once they come into the reproductive age group, in puberty also they can get infections. Infections are common, and we have to teach them proper hygiene, menstrual hygiene. And many of the children, they are really very enthusiastic to use menstrual cup. I don't know really. I personally, I don't suggest for them the menstrual cup. It has its own, because being very busy teenager means your chances of forgetting the timely removal and cleaning, it is there. So it is very fatal. It can cause even fatal infections. And hygiene we have to teach, chances of infection. And pelvic inflammatory disease, it is not really very common to see. We see only the vulvitis, vaginitis, such things. We can treat locally and systemically. We can give tablets, or in the local forms we can treat. Pelvic inflammatory disease, which is more significant, because with each episode of infection, it is a recurrent process. Once you get it, your chances of getting it later also there. So recurrent infections can cause permanent tubal damage, which is the cause of tubal infertility later. And then we come to the reproductive age group. Reproductive age group means after infertility is the common problem. Polycystic ovary is the commonest problem from puberty till maybe 40-45 years. That is what I see the most. Polycystic ovary is actually, it is in your chromosomes, but to certain extents we can prevent by the proper lifestyle. It is considered as a lifestyle disease also now. And if you see it properly, the polycystic ovary, it is not that you will not be having ovulation. It has lots of implications in all systems. Polycystic ovary, if you have the presentation is anovulation. These are irregular cycles, obesity, and hirsutism. Hirsutism means abnormal hair growth. These are the 3 things we see in polycystic ovary patients. So anovulation, that is the basic problem. See, there is no ovulation. So what happens? It is an unopposed estrogen action. Only estrogen is there. Only after ovulation our body produces progesterone. That is the post-ovulatory hormone. If you are not ovulating, continuously you are getting exposed to estrogen. Now the studies are telling, see, unopposed estrogen action is the cause of almost all gynecological malignancies. So that much it is significant. So if you don't get period, please don't ignore. Don't I'll say ignore only. You have to get a medical advice, because your system is getting into problem because of continuous estrogen. Continuous estrogen stimulation can cause endometrial polyp, endometrial hyperplasia, even endometrial cancer. We have seen people at 28 years getting diagnosed as endometrial cancer. Ovarian cancer is also, and cancer breast. This is also all hormone dependent. And your chances of getting diabetes before 40 years is 50%. 50% of polycystic ovary patients, if you don't take care of yourself, you're going to get diabetes by 40. And getting diabetes means you are losing all the protections you have as a female in the life. You will be at high risk for cardiovascular problems, kidney problems, strokes, heart attacks. And diabetes has all, see, the complications of diabetes is all related to the duration. So if it is more than 15 years, means if as a polycystic ovary patient, if you develop diabetes by 35, your chances of by 50, almost all your organs will started have getting damaged. This is really very difficult situation. So if you understand, basically you have to take care. Once you are diagnosed at polycystic ovary, these things you can avoid. And polycystic ovary, and these are the things about polycystic ovary. And in the reproductive age group, other thing is, it's a very common problem is endometriosis. Endometriosis means the uterine lining which is shed cyclically. It is the internal layer of the uterus which is getting stimulated by the estrogen, and if there is no pregnancy after ovulation, it will be progestrogenized. Then if there is no pregnancy, it is shed off. That layer which is prepared to accept a baby is shed off. So this layer, when it is getting deposited somewhere else other than inside the uterus, is called endometriosis. This happens because the uterus has two openings, tubes. Tubes are getting directly open into the peritoneal cavity. So uterus contracts when it induces period. That is the mechanism behind onset of bleeding in period is the spasm of the blood vessels, which causes abrupt cut off to the blood flow to the uterine lining. So it dies there and it is getting expelled. That is the period. So when the uterus contracts, there is a possibility that tubes are open. So little bit of menstrual blood along with little bit of endometrial tissue going into the general abdominal cavity. So most of the time, the WBCs will take care of them if it is minimal. But if it is more, there is a chance of getting it deposited there. And most common sites of endometriosis is ovaries itself. And ovaries, tubes, and the peritoneal cavity. So, and it is endometriosis is we will say it's a destructive disease actually. And what we see from the outside when we do a laparoscopy will be very small dot, but it will be like a triangle. It is. See the tip we are seeing behind it is wider area, and it causes contraction, and this keeps on occurring because with each period the blood deposited there becomes more, and it causes problem shrinking. It is erosive also. So this is endometriosis. This is also familial endometriosis. And see, if you have unusually painful cycles, and once you are married, if you have deep pain while having intercourse, and if your pain is really, if you have rectal pain, means posteriorly behind, anal pain, difficult constipation, all these things are associated, definitely you should think of an endometriosis. Don't delay to go to gynecologist. And this is also, in early stages, we may treat it. But if there is cyst developed already within the ovaries, you will have to go for a surgical management, laparoscopic management. And this is one of the very big cause of infertility also these days, endometriosis. And then comes fibroids. Fibroids also we can call, it is also familial, but these are fibroids are estrogen dependent tumors. So obesity is one of the predisposing factors, and polycystic ovary, because polycystic ovary means lots of estrogen, acyclical, no cyclical opponent as progesterone there. So this makes more chance of developing fibroids. Fibroids are benign actually, but they are slow growing. According to the location where they are, the symptoms caused by the fibroids changes. Small fibroids actually within the uterine wall, it only cause the same, what I said, pain during menstruation, and there may be an increase in blood loss. These are the two things we see. And by location, the fibroids can be outside the uterus, within the uterine wall, or projecting into the uterine cavity. Those projecting into the uterine cavity causes more bleeding, more pain, and infertility. Others actually, we give trials. We can give time for them to conceive. If it is not happening, only we will think of removal. Fibroids, endometriosis, and infertility. The infertility, actually, you see, today's kids, they don't know really, see, what is the significance of ovulation. And they don't know really, you have to have an egg to have a baby. This is what I see now. They start trying for a baby, but they don't know about ovulation. These things are really, as parents, actually, I think we should make awareness for them. This is what I feel. So, really very innocent children, this is what at 25 years, they don't know what is ovulation, what time they should have an intercourse to have a baby. They should get aware of the importance of ovulation. And infertility. Yeah. Actually, see, making them aware of the cyclicity and telling them to maintain a menstrual calendar itself. They themselves can sort out problems. They can see when the pain is occurring, if there is a pain, if there is a spotting, if they maintain a menstrual calendar. And that is very easy for the doctors to diagnose the thing also then, if they maintain a menstrual calendar. So I want all parents to tell the children to have it. So as soon as they start getting period, they should have a menstrual diary. This is very important. Then regarding infertility, really management, all these things, I think if it is needed individually, if there is any question, I will say. And now we'll come to the something which of the later age group is prolapse. Prolapse means lack of support. As we age, and those people who are having more than 3 deliveries, normal deliveries usually, the muscles, they get stretched when in pregnancy, and they are stretched to the maximum while delivery. So, and as we age, there is a chance of laxity everywhere. And some other causes of having prolapse is increased intra-abdominal fat. Whatever causes increased intra-abdominal pressure, maybe it is a fetus, a baby, or fat, fetus, fat, tumor, feces. Even if it is chronic constipation, there is a chance of getting prolapse. Prolapse, what happens is the uterus is situated in between bladder and rectum. So it is actually a support. It's a muscular support in between bladder and rectum. So when there is problem with the uterus, when there is a descent of uterus comes down, means it will drag both these and front part and back part with it. So the symptoms will start as incomplete voiding. You may not be able to void completely. It's second is stress incontinence, means while you sneeze or while you laugh, there will be involuntary passage of urine. And there may be urge. You may not be able to hold urine. Before you reach the toilet, you may pass urine. These things are seen along with the prolapse. And the rectum, see, most of the time it is constipation, chronic constipation. And chronic backache. This is the problem really. Once the constipation is not dealt with properly, it causes chronic backache. And there is something called diverticulum. formation. Because of the pressure effects, the colon will get small bulges. Those can get obstructed, those can get infected, very painful situation. So constipation also you have to deal with. And for this, actually, see, what we can do from our side is, number one, maintenance of ideal body weight. Number two, regular exercise. Number three, increased fiber in the diet, and improved hydration. These things, if you are taking care, actually all these things will not happen. And to strengthen the pelvic muscles, see, something called Kegel exercises there. This is what we advise in the initial stage when the patient feels insecure about the urine. She feels she may pass urine while there is a thought when it comes. If they feel that insecurity, we advise them to start with Kegel exercise and regular exercise to keep the body weight properly. Kegel exercise, actually, it is just holding the muscles around the urethra, the perineal muscles and the urethral muscles tight and count 10, leave it again. When you are sitting idle, if it is repeated 200 to 300 times a day, they say the evidence say that there is a difference in the muscle too. It's very effective, actually. And incontinence. Then now we come to the malignancies. Menopause. We'll talk about menopause now. Menopause is really, it is not an abrupt occurrence. Really, slowly the ovaries, when we are inside the uterus, the eggs start forming when we are inside before we are outside the uterus. The number of eggs in our ovary, it is fixed. From there till the menarche, they are all dormant. Then with each cycle, 10 to 15 follicles get recruited, and only 1 or 2 becomes dominant according to the receptor level. So we are having millions of eggs when we are born. Then with each cycle, atresia. See, only 1 or 2. The rest will go on through a process called atresia. They will just disappear. And there is a point where there is no follicle. That is a situation we stop getting ovulation and menstruation. This is called menopause. So menopause, actually, to consider somebody has achieved menopause means it is lack of menstrual cycle for 1 year, along with the symptoms of hypoestrogenism, less estrogen, because ovary is the main source of estrogen for us. Good estrogen is from ovary. So when ovary stop working means we don't have estrogen. Only estrogen we are having is from the fat that is very low potent but continuously acting. So the changes of this hypoestrogenism means the low functioning of the ovaries can start from 5 years before the actual menopause. The cycles may be very frequent to start with. The short cycle is one of the sign of failing ovary. So the lady who was having a 28-30 day cycles, if she starts getting the cycles 21 to 22 days, means her ovaries are failing now. She's nearing menopause. And then it becomes infrequent. And many of the ladies will have, there is a condition called functioning cyst, like a follicle. Such cyst, which in secrete estrogen, is more common towards both ends of the reproductive spectrum, when they start getting periods or also when they are going to stop period. These two ends, they get such cysts. Those are the commonest cause of for some time there is no period. Then the lady will start bleeding. Maybe it will last for 1 month, 2 months. When we do a scan, we will see a cyst. We call it a follicular cyst. It is a functioning cyst. This cyst is common in such people. So that is also when you don't ignore. See, if you don't get period more than 45 days, because such bleedings which occur with this cyst is prolonged and it is profuse also because of the thick endometrium, and to control it is difficult. We have to give you higher hormones. So please don't hesitate to consult a doctor if your period is delayed more than 6 weeks in this age group. Then initial symptoms of the failing ovary. Number 1 is short cycles. Number 2, hot flushes. You will feel sudden heat wave coming up. Most of the time it is upper body is affected. You will feel red, you will see the body getting red, like flushes and the flash of heat going through you. These hot flashes is very difficult to tolerate. These things are one of the indication. Number 3, lethargy, no motivation, and emotional ability. These things are all associated with menopause. And if you understand this is the situation, then it is very difficult to deal with. Everywhere where you need relief in such symptoms, first is relaxation technique, to yoga and exercise. While you are doing this, you are making the natural pain release and anxiolytics in the body with such things. So you should find your own relaxation technique, let it be music, exercise, film, whatever it is. And the yoga should be a part of your day when you are nearing menopause, actually. And exercise definitely for everything you need it. And there is a controversy between the use of estrogen as a symptom relief for such symptoms. Estrogen, it is already proven that it is cancerogenic. If it is, because most of the malignancies are related to the time period when your body is exposed to estrogen. That means if you have an early menarche and late menopause, your chances of getting cancers, all gynecological cancers are good. So I'd say, actually, I try to convince the patient you don't need. If she is above 45, I tell the patient you don't need extra estrogen. You can make your own. Then if it is really very difficult situation, hot flushes is one of the indication to give estrogen. That too for a limited period only. But if you are a very physically active person, understanding and having your own relaxation technique, it is easy to go through this period. This is what I have experienced. Pause. Yeah, there is something called genitourinary atrophy along with menopause. This is what happens is that vulva, vagina, that area along with the urinary tract, that area is the tissue very much estrogen sensitive. So when the estrogen is cut off, there is a chance that they undergo atrophy. Atrophy means thinning out. So when there is a thinning out, there is a stretching effect everywhere. So even if you don't have any infection, you feel like passing urine very frequently. You are not a feeling of incomplete evacuation, pain. These things will be there. This is called urethral syndrome. For this, we can use local estrogen for few days, not more than that. And you can so avoiding soap actually in that area itself will help a lot in such situation. pH balanced washes are available now. You can use it. And there is something called I'm not remembering. I'll tell you later. There is something called hyaluronic acid, which improves the tissue hydration. The bulk, at least for the time being, means when you are suffering, you can use it. It may be temporary effect will be there with such things. And dyspareunia, that is another symptom ladies complain of nearing menopause, because lack of estrogen makes that area dry actually, no secretions, no moisture. So to avoid dyspareunia means painful intercourse. You can see there are gels available. No, it is not having any chemical actually, just lubricants. You can use such gels also. Then pause. I think these are the things to be spoken about in menopause. Now we will come to the malignancies. Actually, only 1% of all the ovarian cysts we see are malignant. So if you get an ovarian cyst near above 50 or above 45, don't have to worry too much, but you have to rule out because there is 1% of chances there. So many of the time, the cyst usually is of functioning cyst, as I said. It's a follicular cyst. And there are some common benign cysts like dermoid cyst. And malignancy is only 1%, so we don't worry about it. But problem is that really ovarian cyst, because it lies in a big cavity, the presentation will be late. So I advise my patients to have a transvaginal scan yearly once at least. At least once you go for a test. And importance of pap smear also, we forgot to go through it really. Once you are becoming productively active, means 25 years onwards, actually, every 3 years you should have a pap smear. Pap smear is a screening test which see the changes in the cells, shed cells actually. We are taking out shed cell from the cervix and we're looking for changes of the viral infection which have implication on it developing to cancer 10, 15 years later. The etiology, the causative factor for the cancer cervix is 97.3%. It is human papilloma virus. As we were thinking before, it is not only a sexually transmitted disease. No. See, even newborns are having human papilloma virus. So whenever the vagina means we can approach the cervix when the child gets sexually active. That means we can do a proper pap smear procedure. From that time, we are supposed to go for a pap smear every 3 years. This is now the principle actually. And if we see any suspicious smear, we have protocol how to manage it. And this is a cancer which totally is preventable because there is a very effective screening test is there. Now, so every year one transvaginal scan, every 3 year a pap smear, and self breast examination. That is another gynecological malignancy, cancer breast. It is getting very common. That is also, it is coming to a level of more than the familial disease. It is like a lifestyle disease now because of hyperestrogenism. The food, the fat in our body, these things are all modifying the risk factors for cancer breast. For this, actually, you should at least 3-4 times in a year, you should do a self breast examination. You will be guided for that in the YouTube. I'm just advising you to go through the YouTube to get a proper guidance for self breast examination. Self breast examination you should do in the first phase of the soon after the menstruation, because in the second phase after the ovulation there are changes in the breast happening due to the progesterone. So it is to be done. So make it a habit, 7th day of each menstrual cycle, to have a checkup, self breast examination. At least 3-4 times in a year is essential. Self breast examination. If there is any doubtful area, go for. If you are below 40, definitely they will not send you for a mammogram unless there is a suspicion. Otherwise, you can go on a breast ultrasound. That also you can add into your yearly health checkup, because ultrasound doesn't have any bad effect on the body. It's a very safe investigation to go through. It is convincing also. If there is something, the doctor will tell you to go for further. Cancer breast. These are the things I have to say about. So now you can ask me questions individually, then I will answer. I hope I have covered all the age groups. And yeah, something. Yeah. Regarding papillomavirus vaccine, there is a vaccine available now, preventive vaccine in developed countries. It is already advised for the prepubertal girls. Human HPV, there is vaccine available. In India, it is not yet confirmed, added to the immunization chart. You can get it done. It says it is the dangerous strains of virus. 4 strains it is covering. It is to be taken in 3 doses. Available in Kuwait also. What else is there? I think I have spoken about almost all problems. Now, please, you can start asking questions.
Thank you, Dr.
Okay.
Sarita. That was a very comprehensive explanation of all the problems starting from different age groups until, very senior citizens. Thank you very much. I would like young mothers in our group to ask questions first. Young mothers, please, if you have any questions related to your health, your child's health, please, this is the time. Young mothers, then we will give on to the seniors. So, young mothers, please go ahead. Anybody? I think all young mothers are very confident of their health. Do we have any young mothers who are Shimja ji? You're a young mother in our group. Yes, Afroza Sultana, do you have a question? I think they're all very shy.
I just want to tell you something about thyroid problems of hypothyroidism. We are seeing it increasing now. At least in the people I see in Kuwait, many are having hypothyroidism, means low functioning thyroidism. This is most of the time, this is a post-viral autoantibody developing. So if you are, many people come with such complaints, intolerance to cold, not able to maintain body weight, lethargy, all the time lethargy, sleeping more. These things really you should definitely check thyroid. It is always better because being in Kuwait itself is a high risk for diabetes and thyroid because all are having it. I don't know why. So in the yearly checkup, when you go for an yearly checkup, please add that also. Your thyroid is better to be checked because it has implication on the cholesterol metabolism also. And you are nearing menopause and you are having problem of thyroid, your chances of having problem with your heart and BP is more if you ignore thyroid.
Doctor, we have a question from one Mr. Ram. He's asking about his wife. My wife is a breast cancer victim, operated on year 2016, and she is under medication still. So she doesn't have period now, but every month she's getting migraine every month. What could be the reason, doctor?
Migraine actually it is really it's a response to what maybe something she's having which is precipitating migraine attacks, like something in food, like chocolate. The commonest causes are something which precipitate migraine is chocolates, colored food, coffee, and the milk and the milk, meva, all those things, no? I don't know what it is called.
It's mava or something, yeah. The milk products, basically.
Yeah. It is changed, altered. Not milk, actually. Those products used in sweets, no?
Yes.
Such things. And colors, the colors used in food, coffee, and even our Nendrapadam, the Kerala banana, big banana.
Oh.
It can induce, migraine.
Wow. Oh, I thought Kerala banana was one of the healthiest food. It can also cause migraine.
Yeah.
So, Mr. Ram, I hope you...
No, if she gets an attack, you just think of what she had in last 72 hours. Because whatever we take, it will be there in the system for 72 hours. So just recollect things which is unusually she had. And there is something called premenstrual migraine, but she is not having that, and maybe she is having tamoxifen tablet. That is an estrogen receptor modulator, actually. It can also cause. But I think she can have prophylactic medicine for migraine if it is recurring. Actually, she should have a consultation with a neurologist.
I see.
They will advise her. It doesn't have anything to do with maybe the tablet she is taking estrogen. Actually, estrogen withdrawal causes it as a selective estrogen receptor modulator, tamoxifen. She might be having for this her health condition before cancer breast. This we have
So he
to
says
see
that,
the neurologist, please.
Yeah, Mr. Ram says that this is a very routine affair. Every month she has this.
So it is better to have a consultation with neurologist, please. And there is medicine, safe medicines are there for prophylaxis. She can have it.
So hopefully, Mr. Ram, I hope you heard all the answers and suggestions that doctor had given you. So yes, he says, okay, doctor, thank you very much. That was the one question that I received directly. Is there anybody else with any questions, please? And then we will start with the seniors. Young mothers.
Good morning, ma'am. This is Purnima Tamilmaran.
Yes,
So
Purnima.
I have my son. He's 6 years old. Before there is no problem. Now he is breathing through mouth only while sleeping time. But in the daytime, he's very active. There is no complaint. He's breathing through mouth, but sleeping time only a full mouth he's using, and he's struggling to take breath, ma'am. If I close his mouth, na, he's not breathing. He's taking too many attempts. Then only he's breathing. So it's very difficult to find.
Purnima, you have to see that he might be having adenoids. So
Okay,
this is the like tonsils on the upper wall of the mouth. And there is something called adenoids. If there is hypertrophy adenoids, the same symptom will occur. So you have to see an ENT surgeon and see that trying to close his mouth is also not good. Okay, you may turn him to one side. It may relieve for some time.
Yes.
That is not a permanent solution. You have to see an ENT doctor.
Okay.
Please. And this quality of sleep, this will affect his studies also.
Okay.
Having sleep apnea, it is very dangerous, really. You have to take him to the ENT doctor soon.
Okay, ma'am. Okay, thank you, ma'am. Thank you so much.
Thank you, Purnima. Is there anybody else, please?
Good morning, ma'am.
Good morning, Shimja. Go ahead.
Ma'am, I have a question. After delivery, many of the mothers getting thyroid. Now, what is the reason?
Yeah, there is something called postpartum thyroiditis. This is also autoantibody. We don't know really why. Because pregnancy is a very complex immunological system, isn't it? Something very big is growing within our body. No, it's a very, very big immunological. It's a wonderful thing, really. And many people get by 5th month of postpartum, after delivery, 5 months, they get such symptom. It starts with lethargy, weight gain, lack of motivation. The same way it starts. If you ignore it, it may go in for depression also sometimes. Very bad situation. So if such symptoms are there, go for a thyroid test. Because see, this is a condition which can be completely managed with medicine. Taking one tablet before breakfast makes everything fine. So don't hesitate. You should get medical advice. Do a thyroid function test. Those people who are having hypothyroidism before conception, we make them do one more thyroid function after 5 months of delivery. Because whether it has aggravated, we don't know. So we have to see. We may have to change the dosage. Okay?
Okay.
Thank you, Shimja. Anybody else, please? I think the floor is open to everybody. I will not segregate it with young mothers and senior citizens. Anybody can ask questions, please. Even men, if they are here, you can ask questions.
Yeah, good morning. What a nice, exciting session. And thank you very much, Dr. Saiba, for insightful view with full details. Being a pediatric dentist, I would like your opinion as well regarding pregnant women. When they're pregnant, they have sometimes gingivitis, gingival inflammation of the gums.
Yes.
And because of that, those germs, the bacteria might transfer to the kids through placenta. So there was in UK, and many studies have shown that we have to motivate the young mothers or the pregnant women to take care of their gums, oral health as well. And later on, when the kids are born, maybe through kissing and all those things, they can transfer the germs. So Any thoughts about this, please?
Yes, sir. See, there is a condition called pregnancy epilepsy, which affects the gums, gum hyperplasia, focal hyperplasia of the gums. And those having gingivitis, it may become really complicated with bleeding and infection as such, gum and gingivitis, proper developed and gingivitis. So we say all mothers, we tell them to, if those such symptoms, we go guide them to dentist to make the gums healthy, cleaned. And most of the time the dentist will give antibiotics also. And for us, really a gynecologist, for us it is thought that any focus of infection, let it be a urinary tract infections, even significant bacteriuria to be treated. Any infection, any dental caries, everything should be first trimester. We may not be able to do anything procedure as a procedure. Second trimester onwards, they are safe to go for the procedure. Dental extraction, everything, any focus of infection should be removed. This is what we are taught, and we tell the patients also. Regarding this kissing and others, actually we don't say. Right? Really, I never thought of such things. Thank you. Now I will start telling that also.
Thanks,
Thank you, Dr. Sumant, for that wonderful question. I think that opened up a lot of thinking in young mothers as well. Thank you very much. We have a question from Dr. Anushka. Hello, ma'am. For prevention of osteoporosis due to hypoestrogenism, how long should calcium and vitamin D supplementation be taken at a stretch?
And we are actually seeing this is something I forgot to mention, postmenopausal osteoporosis. Yeah. You can start really, perimenopause itself, you can start with calcium supplementation. Calcium supplementation with vitamin D. And the weight bearing exercise is the key actually to prevent osteoporosis. Because the weight bearing exercise, we say, those going for menopause, it will strengthen the bones as well as if they are taking care of the diet and getting supplement, not continuously at least. I tell my patients to take calcium vitamin D tablets at least twice weekly. And most of our Indian mothers are all taking milk in plenty because they know that gives calcium. This is what I see. Patients, they say they have 2 glasses of milk at least every day. If they are aware of this one, those people who know things. Continuance, you can give it really, there is no problem, but too much of calcium is also not good. And we don't think of calcium getting deposited anywhere else if there is no other health problems. It is okay, no problem. She can take continuously, not continuously every day, intermittently, but for a long time. This is what I suggest. But I don't tell them to go for alendronate, those things which are being used in Western countries for postmenopausal osteoporosis. And for us, because I don't know why, because of the lifestyle or ethnicity, we don't see much that bad osteoporosis in our community. The people coming to me below 60 only I see here, not many above 60 I see here. Those people are not, no, they are all okay. We can manage with intermittent calcium supplementation. Vitamin D, I tell them. Calcium also, diet, weight bearing exercise, personally I advise everybody.
Thank you, doctor. I think that was from our young Dr. Anushka. That question came. She was one of Amma Kuwait's.
No, please, Dr. Anushka, please. If there is something to add, let me also know, please. Talk, please.
Dr. Anushka, if you're online, please come on video and have a chat with us. In the meantime, I have another question. My daughter is 14 now. My wife is asking that she has normal period cycle. Any periodical test needs to be done.
No, if she's okay. If you feel she's anemic, you can go for a general CBC, complete blood count. And it's always better as in puberty, once do a thyroid function to make sure her academic ability, everything is properly going on. Thyroid, it is always better to do once in a while for everybody.
We have a question from Sapna. if the mother is having hypothyroidism, what is the risk for daughters to get it?
That depends on why she got a hypothyroidism. Most of the time, as I said, it is a post-viral autoantibody formation. So because of the same situation, the mother and daughter will be sharing the same atmosphere. Everything will be same, no? What they are sharing, the life, the atmosphere, the things surroundings, everything, the food. So whatever factor made it possible for the mother may be there for the child also. So it is always better to have a checkup in between. It will show like laziness, intolerance to cold, lethargy, all these things will be there. If there is something like that, if the child is sleeping more also, this is an indication to do a thyroid function test.
Anybody else?
Yeah, I can see a question in the chat box here.
Yeah.
Somebody has posted it here. Hi, I had a hysterectomy in 2000, had to go through chemo and radiation and immunotherapy for breast cancer. I have this problem to control urine, especially when waking up in the morning. Is there anything I can do for this?
Yeah, this might be hormonal as well as surgical. Actually, you can try doing Kegel exercise, as I said. If it is not of help, definitely you will have to go for a surgical help. There are lots of ways, not very invasive, to treat such situation. Nothing to worry. Try Kegel exercise. The evidence say that within 2 to 3 weeks you will have the effect. If it is effective, you will get a change. You will feel the change. If not, please go to a genitourinary surgeon. There are many things very less invasive.
Ma'am, I have a question, ma'am. What all should
Yes.
be avoided before planning pregnancy, ma'am? Is there any adverse effect of alcohol and smoking on the kids?
Not only on kids, on everybody there is.
Yeah, that is the ma'am. Still, I just want to know.
No, see, here you have to stop. Actually, Western books, they say limit, reduce. But for us, it is no to alcohol and smoking. Because alcohol, really you are damaging yourself. And smoking, you are damaging everybody. And smoking parents, the chances of baby having a UGR. A UGR means intrauterine growth retardition, abruption, placenta abruption, a mother getting BP, preterm labor. These things are common. And after birth, have you heard of something called sudden cot death? Unexplained, the baby dies in the cot.
Okay.
But such things are very, very, very high when the parents are smoking.
Okay, ma'am.
Everywhere
Ma'am,
there
one
is
more question, ma'am. What is the minimum level of vitamin D we should maintain before planning pregnancy?
They see the range they show is 30, no? Above 30
Oh.
is sufficient. Below 30 is insufficient. And vitamin D
What
actually
about-
is proper liver. If you take treatment, there is a provision for storage for 2 years. Okay, so if you take a proper treatment, that means 12 weeks, 50,000 international units, then monthly for six months. That means 12 weeks, 9 months you will have. First 3 months weekly, then monthly for another 6 months. So then it should be there for 2 years.
Okay, ma'am.
At least
Thank
after
you, ma'am.
1 year, because now it's shown that everywhere it is, because it has not only vitamin effect, it is a hormone also. So
Okay.
it is having implication everywhere now. So yearly, if you do a vitamin D also, that is good.
Okay, ma'am. Thank you.
Anybody else?
Yeah, one question, please. Again,
Yes, doctor.
what about the misinformations? Many of the misinfo that spread via social media, talking about home birth. And last week, probably, there was one news. The mother died because the husband was adamant, we will do the home birth, and then he was blaming the medical professionals, saying that earlier they did
She was a
Hello?
previous cesarean. No, sir, are you talking about the incident in Kerala?
Yeah, last week there was some incident. I don't
Yeah.
exactly remember. This Kerala, it was in the news.
Yes, Malappuram. So the
Malappuram, yeah.
lady, she had a cesarean, and see, actually, see, cesarean, you're not supposed to have you're not supposed to think of home birth also, previous cesarean, and maybe there is a rupture uterus because there is a potential area for rupture. No, if the head is not coming down, whatever portion presenting is not coming down with good contraction, this will give way. But home birth, no, I will never advise, never, because YouTube birth. I have heard so many things.
So question is, sorry, thank you very much. Question is, ASHA workers, all the medical professionals tried to convince the last 1 year probably they were trying to convince the dad. What is the ethical issue? How would you like to go about the ethical issue? What our role becomes?
Yes, sir, you are asking about the doctor's role in home birth.
Yeah, because if the parents refuse, if the dad, let's say, refuses, what can we do? We cannot force, of course.
The doctor can, no, see, sensible doctor will never accept such a challenge, because when you need a baby resuscitation, or if you need a manual removal of placenta, what will be the situation? Nobody will, no, I see, a sensible doctor will never take such a challenge. Home birth, no. Because we don't know, it is such a, we are in dark really, we don't know what is going to happen in the next moment. There will be a shoulder dystocia, there will be face personation. These things really you should have something good to handle with. You should have staff, number one, staff, equipments, all these things should be there, no?
Definitely, you're talking about hospital setups, yeah. But
yeah.
my question is, how can we convince the parents? What can we do to? We cannot force them, but how can we? How to try to convince to go to the hospital? Because we know that
these are things. See, I tell, see, if I get a chance, I will tell them really. So this is such a narrow passage. There is no way to approach from outside. Baby also, it doesn't know what to do. It is just coming as per the natural forces. It is getting propelled actually. It doesn't have any control on its movement. So where it is getting stuck, we don't know. So if you want to put your baby in danger, yeah, try here. Otherwise, you go to this, and anywhere it can get complicated now. So even in a hospital, how much we see, sir, there is a cord prolapse. What will be the baby? We are not going to get the baby. See, I will explain all these things. Nobody will be thinking of home birth then.
Thank you very much.
Yeah. Thank you, doctor. Is there any other question from anybody else, please? Since nobody has questions, I have a question, doctor. If you look at my throat here, it has a little bit of bulge.
Yeah.
Yeah. So everybody who sees me asks me the questions, do you have thyroid? And I've done all the thyroid tests and it's all within the range. Then why do I have this bulging?
No, this is a prominent thyroid. We will write. If I see you as a patient, I will write in my case note prominent thyroids. That is because, see, for some people in puberty, there is a growth of everything. So it becomes prominent for some people. Have you seen actress Parvati? She also has the same. Yeah, she was also asking this question to somebody sometime, I remember. So this is just prominent thyroid. If your thyroid function is okay. See, for some people, really cheeks will be more, lips will be more, isn't it? It is just soft tissue. So it's a little bit prominent, that's it.
Oh, thank you, doctor. Any other questions, please?
Hello, doctor.
Namaste. Namaste, namaste.
Namaste, doctor. Doctor, could you just talk about this surgery for urinary incontinence? Is it very effective?
Yeah, it is effective. Don't worry. It is non-invasive. There is injection of some material which will support tissue support as tissue support. Okay. After that time, maybe 1 or 2, 3 years, you may have to redo it. Means just injection on either side to give support. But that's nothing to worry. Don't worry. Okay. It is very, very effective and very less invasive. Okay, but it should be done with a proper person. But you can try
Usually
here.
gynecologist,
Urogynecology.
urogynecology. Okay. Okay, thank you.
Thank you, Vidya. Doctor, do you do this procedure, this urinary incontinence?
No, it should be specialized people should do that.
I see. Do you recommend any doctors or clinics here in Kuwait?
I will check and I'll let you know, because now I don't have somebody's name in my mind. No, I will check and tell you. People are doing. There is one Dr. Barka in Sabah, whether she is in private communication. Namaste.
Namaste.
So I will check with her and I'll let you know.
അത് KCC-ലെ ഡോക്ടർ ഫിലിപ്പ് അവരൊക്കെ ചെയ്യുവോ?
ഇല്ല, ഇത് ഒരു ഡോക്ടർ ബർക്ക ഉണ്ട് നമ്മുടെ സഭാ ഹോസ്പിറ്റലില്. I'll check. ഞാൻ വിളിച്ചു പറയാം. ചോദിച്ചിട്ട് പറയാം.
I think, Vidyaji, you opened up a very nice topic. I think that's a very prevalent problem with many of the seniors here, urinary incontinence. Thank you very much, Vidyaji, for bringing up this topic. Is there any other question from anybody for anybody else? Please. We have crossed 1 hour, valuable Dr. Saridaji's time. So if you have any more questions, please, otherwise we'll wind up. Okay, I think there aren't any more questions. Let me check the chat messages. Smitaji, are there any more chat messages?
No, nothing from you.
Nothing. Okay. Thank you. Thank you. Dr. Saritaji, it was wonderful talking to you. It was like, having a coffee in our hand and chatting with a neighbor or somebody like that. Very, very informal. It was. You made it very informal as well. It was really nice. Many people really benefited from your talk, Dr. Sarita. And, as a vote of thanks, I have to really thank Smitaji for contacting you and getting your permission and your timing and all of that. Smitaji, thank you very much for this. And I also have to thank Smita's husband, Rameshji, for providing all the back-end support. Thank you very much, Rameshji. And of course, all our Nari Shaktis who had logged on to this and made use of this Sri Shakti seminar very well. Thank you very much. We will come again with more such interesting programs, Dr. Saritaji, depending on your time availability and maybe specific topics. Maybe we will come back to you if at all you are available. And it will be really nice. It is, we find really comfortable talking to you, Doctor. It was really nice. Thank you very much. Thank you. And I thank Amma Kuwait for arranging the whole thing for us. And thank you one and all for attending. I think we have to say bye-bye.
Thank you all.
Yes. Dr. Saritaji, do you have anything to say, please?
No, thank you so much. Really, it was a really wonderful time spent together, and I had 2 people, 2 doctors also join. That is good.
Yeah. Thank you, Doctor.
She didn't answer. Please ask her if there is something to be added from her side.
Dr. Anushka, yes, I will. Thank you, Doctor. Thank you, everybody. Namaste. Let's log out. Thank you.
Thank you.
Thank you. Thank you, Purnima.
Thank you. Namaste.
Namaste.